Okay, let's talk about something within the crypto space. As you can see there, you are seeing 7.6 trillion healthcare industry, and they want to become a new operating system of a new industry. Now, I want to say something. If a company wants to establish itself as the operating system, do you know what they call operating system? That is, you have Android devices, and Android is the operating system that runs on over 2 billion devices, right? You have Windows computers that runs on millions of computers, right? Now let me say something to you. Health is wet, and if health is wet, I will not just present myself to someone to treat. What the system want to do, I will tell you some of the things that the system want to do. But first, what do they want to do? They want to build a reputation online, and with the people, they want to become 3 things. First, they want to be Booking.com. Let's open them and you'll be seeing them for yourself. Booking.com. They want to become the Steemit of Steemit. Then they want to become the Salesforce. They want to become 3 in 1 of this. Now you already know Booking.com is where you book hotels. Steam.com is where you actually make blog posts. And then they want to become the Salesforce. These 3 things. The question is, are they able to do this thing? I think they are able, because they've already developed a working model for over the past 2 years. This is the website. It's in Bulgaria. As you can see, my browser. Okay, sorry, Hungary. My browser translated it. Okay, it's been translated now. Let's see. Okay, it's been translated. Okay. Reliable physician close to you. There are 4,242 physicians in the list of your service, and you will see the place. Every year, over almost 30 million people find a reliable doctor. What are they actually trying to do in a nutshell? What they want to do, they want to bring in a system where first, the person you are actually going to meet to actually give you consultation on your health status, or run a health check on you, or actually diagnose you, or maybe actually treat you, you are going to see the profile of the person. You're going to see the qualification, you're going to see their past, and then you're going to see the business, how they've done business with people in the past. So you're having a platform where it's immutable. So someone who actually done business with that doctor is going to recommend that doctor to you, or is going to tell you, please stay away from that doctor. That doctor does not know what he is doing. So when you have a platform, I've heard cases in Nigeria where someone who did not actually went through the medical school had an hospital and was delivering babies. How do you see that? That is insanity at the highest level. Like, you are playing with people's lives and you don't care because you want to make money. But the blockchain is here to change all those stuff. Let's look at the white paper and let's see some of the things they want to do. Okay. They talk about the issue of medical tourism. I was listening to a video and thinking about medical tourism that I think it was a hip surgery cost, I might be wrong, but that was what I saw. That was what I saw on the video. It cost $100,000, $100,000 in the United States, and it cost $4,700 in Mexico. So you see the medical tourism industry, plenty of money. So you have to understand what is medical tourism. Now, medical tourism has to do with the system where people leave their country to another country for the sake of health purposes, maybe for treatment, diagnosis, or whatsoever. Now, as these people are going to these countries, you have to understand that there is an influx of people, and this influx of people actually causes congestion sometimes, as though the returns are very good, and most of these hospitals they scale up the business and so that they can accommodate more clients, but there is this issue that the indigenous of this country can actually be faced off with the issue of not being attended to. Right? Put that aside. ETHEAL is about to change all that. I want to say something to you, that there is a professor at Harvard who is in strong support of this project. Let me play the video for you so you see.
There should be a general knowledge about a medical doctor, but I'm pretty sure that only several doctors are known as, let's say, good surgeons. Most probably there are more than that, and this project will be able to show all of them, and we can choose the best one, who is the best for us, who can do the intervention in a professional way, and we will be quite satisfied with that. When I saw it for the first time, I just realized that they want to do the same thing. They are going to establish a database which is coming from the society, from the patients, and this database will be the one who is going to replace that kind of workplace-based assessment we were planning for a long time. I started to work at the University of Veterinary Science as a researcher. Then later on I was abroad at the Harvard University. Lately I became the vice rector of the university, and also the thing that is very much interesting me is the educational research. What is the good way to teach students? The good question is, should we leave the medical doctor or a veterinarian alone in a room with the medical doctor be able to cure this patient properly? The question is, how can you make the outcome assessment of these students? And now this is the surprise. It's most probably not the veterinary school or the medical school who can do that. It's most probably should be organized from outside. But then I met the ETHEAL project. How is it working? Everything what is coming as a feedback from the medical doctor will go to a database which is an encrypted database. It's a blockchain way encryption. Why is it good? Because you cannot manipulate this kind of database at all. And if you cannot manipulate it, that will be good for us because we can choose our doctors. Why I'm very positive with this startup is that I think they have a good business model, and if they can provide that one, and this is a real need from the society, and the real need from the universities, and it's a real need from the hospitals as well. So if they are going to do that, I think there will be a long-lasting, good project that is coming out of this.
Okay, you've heard what the Harvard professor said. That guy is the vice rector of Harvard University. Okay, put that aside. Let's talk about what these guys want to do. The first thing is a trust call, which deals with the reputation of a doctor along the lines of past transactions with business clients. So the business clients are going to be the one who will actually give you a review. You're not just giving a review because you want to give you a review. Every review is verified in the system. The patient, did you actually have a contact with that doctor? All these things will be reviewed. Then another thing again is you can earn ETHEAL tokens. The name of the token is called ETHEAL tokens. You can earn ETHEAL tokens by seeing and interacting with ads, surveys. Then we'll have the communication research paid for by pharmaceutical companies. Now let me say this way. This thing is cutting across pharmaceutical companies, hospitals, medical universities, and then doctors, and then the patients. The system want to build they want to build a system where your data is treasured. So there is no exploitation. I think there have been some cases in the United States where pharmaceutical companies are actually exploiting people's data without their permission. I told you that the problem of data is a very very big one, and it's growing in astronomical dimensions. And it's time for the people to actually speak up and put an end to these things. Let's talk about the issue of fake doctors. Okay, I've talked about the issue of fake doctors. Let's see page 49. Mind you, if you're a developer, you can actually develop systems that can actually help this system scale up the transactions. Currently, they've been working in Hungary and in Brazil, and they want to take this thing to the next level. Why do we need a dedicated token? An internal token can be used as a dedicated method to access discounted service and to transfer value. The fair initial distribution and balanced long-term initiative rewards those who use and contribute to the system. What is the use of e-token payment and discount? If you have this, you can get a discount between 20 to 40%. Community incentivization and the rest of them. And then this is the ecosystem: patients, care providers, apps, pharmaceutical suppliers. So if we have become the booking, the Steemit, and then the Salesforce of health system, to be a very, very good one. And do they have competition? Let me tell you some of their competitors. Some of their competitors has to do with Doc Plan, and there is another 223 million dollars, and Doc Plan was able to raise $50 million. So they went through the system and said, wow, so we can actually raise money through the system. So that's why they're coming to the blockchain currently. So they are focusing on two things: healthcare, pharmaceutical, and then medical tourism. As you all know, that the healthcare system is 40 times bigger than a hotel service. You should pay very key attention to this project. You can contribute to this platform. You can incorporate your, if you are in the medical field, you can actually contact health here, and they will include you in doc list. So someone is searching for a doctor nearby, they can actually pick you as one of the doctors as the choice. You can join over thousands of doctors who are actually in the eco space now. Let's see the team. Okay, who is behind the team? You have Dr. Mihaela Kles, Victor Taboro, Lazo Marin, Leventin Todd, Gabriel Cesare, and Dorina Fadi. One of the reasons why I have a very huge confidence in this team is the products they have and the endorsements they have. I had guys from Google and some other stuff. So guys, that's all I have to say about this project. Think about this project.